How do antipsychotic drug interactions affect pregnancy? Have you ever wondered how taking antipsychotic medications during pregnancy might impact both the mother and the baby? Let's break it down in simple terms. Antipsychotic medications are often prescribed to manage schizophrenia. They work by balancing important chemicals in the brain, like dopamine and serotonin. However, when these medications are taken during pregnancy, they can interact with the developing fetus in various ways. First, it is important to know that while there are some risks associated with taking antipsychotics during pregnancy, these risks are generally low. Studies show that the chance of major birth defects in babies born to mothers on antipsychotics is similar to that of the general population, estimated to be around 3 to 5%. This means that many second-generation antipsychotics, also known as atypical antipsychotics, are considered to have a low risk for reproductive health. The first trimester, which is the first 3 months of pregnancy, is a critical time for fetal development. During this period, the fetus is more vulnerable to the effects of medications. Therefore, caution is especially important when considering antipsychotic use during these early months. As pregnancy progresses, particularly into the 3rd trimester, there can be additional concerns. Babies exposed to antipsychotics may experience temporary muscle tone issues or withdrawal-like symptoms after birth. While these effects are usually short-lived, they do require careful monitoring by healthcare providers. Moreover, using antipsychotics during pregnancy can lead to an increased risk of gestational diabetes and excessive weight gain in mothers. These factors can complicate the pregnancy and affect the health of both the mother and the baby. Healthcare providers often keep a close watch on these changes throughout the pregnancy. Pregnancy also changes how the body processes medications. This means that dosages of antipsychotics may need to be adjusted to ensure they remain as effective while minimizing side effects. It is essential to manage schizophrenia effectively during pregnancy, as untreated symptoms can pose risks to both the mother and the baby. When it comes to breastfeeding, antipsychotics can pass into breast milk. This raises questions about the potential effects on the nursing infant. Decisions about continuing antipsychotic treatment during breastfeeding should balance the benefits of the mother's mental health with the possible risks to the baby. In managing schizophrenia during pregnancy, it is vital to work closely with healthcare professionals. This includes psychiatrists, obstetricians, and pediatricians to monitor the effects of medication, adjust dosages as necessary, and observe for any adverse outcomes in the infant. In summary, antipsychotic drug interactions during pregnancy can have various effects on both the mother and the developing baby. While there are risks like congenital malformations and neonatal adaptation issues, many atypical antipsychotics are considered relatively safe under medical supervision. The decision to use these medications during pregnancy should always involve a careful assessment of the risks and benefits to ensure the well-being of both mother and child.